It's important to treat a patient with dignity and respect during their stint here in the hospital, but also when their life is coming to an end. We want to ensure that all of our patients, especially those without friends or family, have someone there as a support system. I think this program is going to do wonderful things.
NODA is a program that originated in a hospital in Oregon a few years ago. It stands for No One Dies Alone. So studies have shown that the two greatest fears that people have is to die either in pain or to die alone. So NODA is there to bring in a sympathetic and trained volunteer and stays with them as long as they're wanted and needed.
In about 2011, Leslie Irwin, who was a board-certified chaplain here at Ben Taub, and I were talking about the need for a program like this, and I had seen No One Dies Alone on the internet, and she was familiar with it, and so we approached the Director of Spiritual Care, Jeff Lancaster, and asked would he support us looking into it, buying the manual, and possibly proposing to the board that we implement a pilot study.
I think this will be really beneficial to our patients because, on rotations I've seen lots of patients who are alone, whether that's because their family is in a different country or whether they've kind of lost touch. And I can't really imagine a harder time to be alone than during the last few days of someone's life. And so I think offering this sort of companionship is something that every patient deserves.
It's a very sacred moment because it's the end of everything that we've ever known, and the beginning, I believe, of a new journey that we've not yet experienced.
The result we're really hoping for is that patients will have comfort and peace when we're able to go and spend time with them, and that the volunteers who participate can also really have a meaningful experience as well.
I think it gives non-clinical employees a chance to bond with patients. In the initial iteration had people from EVS and dietary, and they were so eager to have more direct interaction with the patients. For our nurses who may have a caseload of upwards of 6 patients, and it's very hard for them to leave a room of a patient that they know death is so imminent. So it comes full circle in that it's a benefit for everyone.
Right now we are accepting volunteers who are medical students or faculty connected with Baylor and employees of Harris Health. They can volunteer by contacting the spiritual care department at Ben Taub or Kristen Schultz at Baylor College of Medicine.